meeting for Thursday, May 28th, 2026. Are we recording, sir? Good. If you will, if you will please join me in the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic which stands one nation, indivisible, with liberty and justice.
Difficult for you to do with that, sure. Next on our agenda is roll call.
Commissioner Hoffmeister?
Here.
Commissioner Houts?
Here.
Commissioner Leininger?
Here.
Commissioner Collins? Commissioner Schaefer?
Here.
Commissioner Smith?
Present.
Thank you.
6 members present. Next is the approval of the agenda.
I'll make a motion, we approve the agenda as presented.
We have motion from Commissioner Hoffmaster and support to approve the agenda as presented. Any discussion? Hearing none, all those in favor say aye.
Aye.
Those opposed, motion carried. Item 1D is approval of the minutes from our April 23rd, 2026 meeting, and those are attached.
Move for approval, Mr. Chair. I'll support that.
Have a motion from Commissioner Schaefer and support to approve the minutes from our April 23rd meeting. Any discussion on those minutes as presented? Hearing none, all those in favor of approving the past board meeting minutes, say aye.
Aye.
All those opposed, motion carries. Next on our agenda is item 2, public comment. This is the opportunity for the public to come and speak to the board. A reminder that during public comment, we do not interact with the public here. That this is their time to speak and address us. Those members wishing to speak should give their name, and they are limited to 3 minutes at this time. So the podium is open for anybody who would like to address the board at this time. Any public comment? Hearing none, we will move forward. The next item is the health officer's report.
All right, good morning.
Good morning.
So just a few updates for you here today, but I did include a couple of photos of our roof going on at Three Rivers. And the one photo depicts the end of the building that the second middle photo there, that's the end of the building where the roof was lost in the tornado. You can still tell the air conditioners look like building blocks in that photo. And of course, the exterior cable line still needs to be rebuilt. But the good news is the roof is on, it is done, and it looks good. So really happy that we made progress there. Lots more to do, of course, but it is nice to see forward movement. We have also going on the website redesign, and we're really taking a hard look at everything that's on the website and what do we have to have on our new website and what can we let go of. As you all probably know, there are a lot of rules around the accessibility of items that are put on a website that we have to take a look at. And so there are items that we have there now that don't meet the criteria for accessibility. We're going to have to let them go and either come up with a different way to display that information or allow people access to it, or just, just let it go. So Chris Dewey and her team are taking lead on this project, and we are interested in what you really want kept in the Board of Health Resources section. So if you go to our homepage now, scroll all the way down to the bottom on the left-hand side, there's the Board of Health Resources. That's where the minutes and these agendas and the videos there, as well as a section that contains bylaws of this group, lots of other information that it's intended And so some of those things, obviously, we really want to keep, but we did bring it up to the PPA committee, and we'll probably continue to have conversations about what's there, how we can keep it on the website so that it meets criteria, and still looking for any feedback you have. So if you're not part of PPA and you have input on that, we'd still, like to hear from all of you, so. And you can share that information with either myself or with Chris. The Community Health Improvement Strategic Plan Project, we are working on that as well. We've been to all of the human service collaborative bodies to gain input from those nonprofit leaders on priorities. And our contractor also met with directors and supervisors of the agency. The community input sessions are completed, so we're getting closer to completion on that community health needs assessment piece that'll lead us into the community health improvement plan. There is another survey that's going to be coming out that you'll be receiving that helps us move towards the improvement plan piece of that, and that should be coming out in the next couple of days, right? So just watch for that, and we always value your input along with all the other people that'll receive that information and provide their feedback to us. We do have today the final budget amendment for FY26. The Finance Committee took a look at that at their meeting. We do have also some area agency on aging action items. So the final provider amendments for fiscal year 26. The Finance Committee reviewed those and approved them for the full board to approve. And then the Program Policy and Appeals Committee reviewed the FY 27 through 29 multi-year plan and recommended this for full board approval as well. So those are some items coming up on the agenda. We still have an environmental health administrative assistant position open in Hillsdale County. But I think we took care of the clerk, didn't we, in Three Rivers? Is that position filled? Yep. So since I typed this, that position has been filled, but we're still looking for the administrative assistant for EH in Hillsdale County. The annual distribution, I just have 2 meetings yet, and they are coming up here soon. St. Joseph and Hillsdale counties. I'll be in your commissioner meeting to present the annual report. Those are already on the schedule. In the Coldwater office, as far as items that have happened and worked around here, we still need to identify a contractor to clean ductwork here in this building. I did want to let the board know that there were some roof repairs made to this building. We received the bill for that. Our portion, as you know, our lease indicates 60% of repairs to this building are our responsibility. We will be reaching out to Administrator Walsh and probably his assistant Jessica to talk about letting us know that bills like that are coming because we didn't know. We received the bill, it was a little over $8,000, and we were not aware that it was coming, and so it didn't make our budget amendment. So we're going to reach out to the administrator to let him know that we certainly appreciate the maintenance of the building, but we do need a little bit of heads up so that we know bills like that are coming our direction.
The bill was submitted to our bill, and then they caught that your 60% was the house bill. It was also.
So it was the should stop.
What had to be repaired?
The roof.
That's all you know.
So Teresa has the bill. I think she can tell us
You
more.
have to scope.
Scott submitted it, he didn't submit. It was a bill, they called it later. Our-
Well, I am going to reach out to Frank and just, chat with him about it.
So the scope of work included thoroughly clean and prepare all repair areas, repair 11 punctures, splits, and holes identified, reseal approximately 230 linear feet of seams, repair the open flashing, laps, corners, and patches, reflash 3 stacks, reseal 4 penetration packets, disassemble 4 drains, remove existing flashing and sealant, install new drains. clean and properly dispose of debris, remove properly disposable debris. That's
Sounds like normal maintenance kind of stuff to me anyway.
Whatever you would do on a roof like this, sure. Yeah.
So, yeah, not something that I should sneak up on, is those, trying to say, I guess.
Would have been nice if we had known though that it was on the schedule and that it was happening.
Yeah, I agree. I mean, that is on us. Yeah.
But thank you. Yeah, I'll reach out to Frank and just talk it over with him.
So let Tim and John know about it. You're gonna get with it.
In Hillsdale, the HVAC upgrade is really pretty much finished. There's just some final drywall that's being, it's up. They're just still mudding, taping, painting, just finishing that piece up. But the rest of it, it's in, it's done. And so we're glad to have that project pretty much wrapped up. Nothing in our Sturgis office at this time. And as you know, in Three Rivers, the roof is done. We are continuing to meet on Fridays with the property claims manager from MMRMA. And we do have, so Van Dam and Cruisinga, if you look at the photos, you can see that the downspouts are white. The gutters are white, and of course the gable ends are white. And you can also see that there is some overlap on the standing seam that's brown. And so the question, because they're going to have to replace those downspouts, you can tell the one there on the top picture, although that's not the end of the roof that was torn off, there is damage to the gutter and downspout. Whereas on the other end of the building where we lost part of that roof, you know, of course, all of the downspouts are gone. The gutters are gone for a certain distance down the building. So, you know, he's asking at this point, do you want to go back with white because so much of this is going to be replaced? Do you want to do brown so that it matches? I've asked him to give me a price on if there's a part of that that insurance wouldn't cover, so that we understand if we do decide to change to a different color, what that might look like as far as cost. And I haven't gotten a price from him yet. So I guess when I do, I'll bring it to finance. From there. Brown would look nice. But I mean, I guess I want to know what the cost is. Yeah. That is what I have for you today.
Mr. Schaefer.
The temporary relocation, how has that gone? Is the public been okay for the most part? Or is there a lot of confusion yet going? What's your thoughts?
Well, they're finding us. We are seeing clients there for a clinic on Mondays and Tuesdays.
Okay.
And they're finding us as far as EH services go. So they're finding us. Is there still confusion? I mean, I'm sure there's still people that drive through 1110 Hill Street and they read a sign and they're like, oh, you know, where's this place at?
Right.
But people are seeming to find us, and I mean, it's small, you know. On Mondays and Tuesdays, we kind of jockey staff around to fit people. Like, I don't go there on those Tuesdays, because there's just too many people there running clinic. And that's okay. You know, we make concessions to fit everybody and everything in there. It's working out.
Good.
So, thanks.
Any other questions for the health officer? I've got a couple. In regards to Three Rivers building and that potential change, why did we go white when we did that? Just because that fascia and stuff and soffit is just what, 2 years old?
Yeah, it's not old at all. Why did we go white? I don't know that I have a good answer.
But
for
the
that.
Hillsdale is matches more with the
Matches more.
brick and the roof.
Mhm. I thought it looked great at the time. I don't, you know, I don't.
Well, it looked new, so it probably did look great at the time, yeah.
I mean, because we've got some window trims there that are still white.
Yes, we sure do, and those were
Those are-
painted, yeah. Yeah.
Well, those are gonna change as well or not?
You know, that we would have to paint those if they're gonna be brown. The air conditioning units, though, as you can tell, continue to be that brownish color, brown tan.
Was it originally white eavesdrop? And when you did the face and soffit, they just never, they didn't have to change the eavesdrop? Cause I know they did it.
Remember, we did not change the depth counts in that.
Okay. So she says it was already white, and I just. don't
So you
remember.
just did the face and soffit and
Yeah.
called it good.
It's gonna look fantastic.
Keep it.
And the other question I have, you're talking about cleaning the ducts here in the building. Why are, again, we're a tenant here, sorry, Branch County, but that's something that you guys should do and we pay the 6% on,
What?
Ducks.
cleaning their ducts.
Oh, I'm not sure what Lee says about that, actually.
Yeah, just look it up.
Yeah.
They need to be cleaned.
Yeah, so it's
we
not a
have-
repair per se.
Yeah, we have
But
some
it's
of
still
these.
building maintenance.
Correct. But,
Yeah, like our dog shelters, it's maintenance, this is shared goes.
yeah,
I think we've brought it up and then we just, like, if we want it done, we have to get it done is kind of what we've been told.
How often?
Oh, it hasn't been done in a long time. Yeah, and they're starting to spit dust on people. For, yeah, little furries.
you said you're getting a price for that?
We need to work on that. We have not identified a contractor yet. Yeah. But we do know that it is not a job the county does. So we need to find a contractor. to do
Yeah,
that.
I mean, I'll look at the contract.
Yeah.
But, yeah, I mean, I think we should check the lease, just to be sure.
You make contact with Frank, maybe we look at it.
Yeah, that'd be good.
Can we change it?
Yeah, I wanna change it, I have some serious issues with that, Lee, so.
Goodness.
I'll be bland, Mr.
Okay. I will do that.
Thank you. Anything else? All right, moving on. Medical director's report. Dr. Luparelli.
So, in the packet, I didn't add a couple of Ebola meetings, which spurred my little educational piece today. So, I thought I'd talk on Ebola since it's all over the news. Hantavirus, very similar, also what's going on, but Ebola disease is caused by a group of viruses, ortho-Ebola viruses, and they cause illness and without treatment, obviously can lead to death. And if you look in the literature, it usually shows a death rate between 25% and 90%, and so they kind of use 50%. So pretty fatal disease if you get it, and it's not treated. And it was discovered in 1976 in the Democratic Republic of the Congo, and those viruses were primarily found in Saharan Africa. There are 4 types of viruses that can cause human illness, 2 types that so far have not affected humans. And symptoms are similar to hantavirus, where we have a dry phase and then followed by a wet phase. So the dry phase is fever and aches and chills and fatigue and pains in all your joints. And then as it progresses, you get what we call the wet phase, which is vomiting and diarrhea and this unexplained bleeding, which is what most people die from, right? Like rapid fluid loss, and then you just can't keep up with their fluid volume. So you get it through contact with bodily fluids from an infected, sick, or even a deceased person. And there have been reports of contact infected animals, and those are mostly bats and not human primates. So that's the big issue with Ebola is you're taking care of a patient, you're not totally protected from all bodily fluids, then healthcare workers get it, you know, the neighbor in the hospital room gets it, and then those sheets, the towels, and all of those things are infected with Ebola virus. So it travels around pretty quickly too. There is one FDA approved vaccine. It's kind of in our stockpile. So If you're usually a healthcare worker at high risk, we can kind of work to get that vaccine, but it is not a public, like, oh, I'm gonna travel to Uganda, so can I get vaccinated? So, it's kept in our stockpile. So right now, as of actually yesterday, in the Democratic Republic of Congo, there are 906 suspected cases. 106 of those are confirmed with lab work. There have been 223 suspected deaths and actually 10 confirmed that were linked directly to Ebola. So that's a lot of patients. And I don't know if you read, you probably saw that on May 17th, there was actually an American worker in the hospital and he got infected with it. So what we do usually is there is a hospital in Germany that's kind of the specialist for treating and keeping Ebola patients and isolating. So that patient to Germany. So it's also closer, obviously, right? So that would be a pretty long flight to go from Africa all the way back to the US. So we have some agreement with a hospital in Germany for treatment, keeping those people isolated. So from a public health perspective, what are we doing, right? So those are my meetings. And so the CDC is screening, obviously, flights and people coming in from those areas. And if there are infected people on planes from those areas, they're going straight to Washington Dulles and Atlanta Hartsfield Jackson. So I kept that in mind when I'm going to schedule a flight. I might not want to go there, but they have some specialized screening processes there. We're also working, the CDC is working, directly with patients flying and patients coming in about the symptoms, what you should do if you have those symptoms, and isolating people. So usually the symptoms start anywhere between 2 and 21 days of exposure to the patient. So you can imagine that if you think you might have been exposed, we have to keep you isolated for 21 days. So they are isolating a lot of people, not in the US, but elsewhere. So we're working to get information out to those countries. We're tracking the disease there. We're looking at their lab reports, the virus sequencing and what virus it exactly is. And it has come down to the local public health level. We were just talking about it yesterday, that now we're going to get a notice if any of the patients in our counties have flown to these areas and are coming back to our counties. We are going to get a notice and we're going to be responsible for checking and making sure that they're staying home, and if they have any symptoms, what we're doing about that. So it has kind of transposed from the CDC level, and they've come actually all the way down to the local health department level. So we're going to be intimately involved if we have anybody that's traveling from those areas.
You know the exact area.
So far, Uganda, the Democratic Republic of Congo, and Sudan, I think. South Sudan. So I don't know that we'll have that many patients in our counties, but we do lots of mission work that I see people traveling to those areas for still. So I don't know. Mission work should be put on hold in those, communities if you're traveling there. I have to really think about it. So I thought that was, public health, like what the CDC is doing, and they have had meetings and good communication to let us know what they're doing and how they're isolating people and checking on symptoms. We haven't had any cases, thank goodness, in the US, but clearly it is elsewhere, and travel is so easy right now.
What are the two things?
Oh, yeah, there is a call to there too.
Any questions for Dr. Duperello? Hearing none, move forward. Thank you, Doctor.
Thank you.
That brings us to item 5A, Department Reports, Area Agency on Aging. Miss Laura.
Hi, good morning. I'll thank you in advance for your time and review. There's a lot of content that's aging specific, a lot of committee work that's been done over the past month. And so we've appreciated your time and input until culminating today during the meeting. I hope you've taken a moment to soak in Older Americans Month. This month of May 2026, Champion Your Health is the theme. And if you've seen our website or our social media posts, Chris and her team have been very active in sharing. advocacy tips and tricks to maintain a healthy, well-rounded lifestyle and live as independently as possible. So we celebrated Older Michiganians Day on May 13th. It was a fun day at the Capitol on the lawn. It was very cold. I was very appreciative. Miss Ellsworth lent me her hat because I did not dress as my mother would have advised me to dress that day. So she was very kind in lending me her hat. We had great attendance. It was dampened by the cold weather, but it was a beautiful day. And we did have a new advocate join us from the Union City area. So that was kind of fun to expose this gentleman to what the Aging Network is and how we share messages with our elected officials. We did meet one-on-one for a significant amount of time with Senator Lindsay, and then did make stops at both House of Representatives members. So it was a great day. I did bring the platforms if anybody wanted to take a look, and they're behind Commissioner Stoll on the table. But we had very similar messages as in the past because in-home services are still so highly prioritized. We want the state legislature to consider an increase for both home delivered meals and other in-home services. So we also had a moment to share a little bit about our victim assistance program. So we wanted to highlight that as well. The plan is on the agenda for later this morning, but we did receive just this week after after the amended board packet went out, and if anybody would like a copy, please let me know. Just notifying the board and Commissioner Leininger that Ashley, our regional aging representative, will be conducting an observation visit with us tomorrow during our Transportation Authority assessment in St. Joseph County. So, and I did receive the financial information that Teresa's team reviews upon when we get a new finance director at a community partner providers agency. So they're in good shape for the visit tomorrow. So thanks for coming down to our region twice in a couple of days, actually. So again, if you'd like a copy of that letter, it just states that they'll be with us tomorrow. Still working hard with our victim advocates in St. Joseph County to arrange for that Elder Justice Symposium. We were able to make a request to the Community Foundation, which will, I think, going to be renamed St. Joseph County Community Foundation. They've merged, and so I believe there's a name change. But we've asked for some community support funding to help with the refreshment side of putting on a training event for around 100 people. I kind of want to feed people, at least I do. It helps with attendance. It helps to keep people's brains and bodies moving and learning mode. So we'll hope to hear soon on that community support grant, because our grant funds won't pay for food or for drinks even for an event. So and when you have the Attorney General's office coming, you kind of want to have something nice for them to perhaps munch on as well. So our budget amendments, again, further on the agenda. We did take a very comprehensive approach, as we always do. So thank you again for your time and review of those. We have a new outreach specialist that joined our team last week. Her name is Nina Smith, and we'll introduce you at the June meeting. She's been very busy. There's a ton of reading with that position at the onset. And so, she's got some neat direct care experience. So that will help with the customer service side of that position. So we're excited to have her. My options remains busy with calls and walk-ins and referrals. We're also working on a campaign and again, large in part with Chris and her team to promote caregiver supports and services and the new state website, My Caregiver Connection. So that'll be fun to kind of promote locally, and Chris is helping us work on radio ads and Spotify and Pandora, and I don't know, there's even there's a rack card that we've developed with some of the campaign materials that were developed. So it's kind of fun. It's a new way to outreach to caregivers and to give them an avenue to find support when they need it. I mean, for example, we received a referral a couple weeks ago from a caregiver that filled out the online sort of self-assessment of kind of their stress level. and that was at 10:30 at night. It came through our email system. So people stay up late and they're troubled, and we want them to know that we're there and we can be a resource for them. So we're glad to have Chris's team's expertise to help us market and promote that. The rest is just plan highlights and some of the sort of the modes that we've conducted the plan this year. And I think that's really, the business is a little further in the agenda, but are there any questions or any topics that I might not have touched on that you want to talk about?
Good question.
Commissioner Schaefer.
The community awareness seminar that you mentioned a couple of minutes ago. Do we have a place yet for that and date?
Yeah, for the Elder Justice
Yes.
Symposium, yes. Actually, upon your recommendation, the training center in Centerville has worked out. So
Oh,
we're
good.
gonna give that a go, and we'll probably look at some signage for parking, because I've heard that parking could be complicated, but we also think it's a great central location. So even if departments from just outside St. Joseph County want to join us, it will be put out on their communication tool, the LEAN system, so that law enforcement can come. And typically we get a couple sheriff's office representatives. We've had them from Cass, we've had them from Branch that have come over. So perhaps even north of us come down. So
Yeah, we're trying to utilize that training center. So yeah, thanks for checking into that.
mhm.
Sounds like it's gonna work.
Yeah, it
out.
was a great suggestion, and the sheriff and the undersheriff were very open to that. So we're glad to be able to use it. But thanks.
Is the September 17th date, that's the date, right?
That's the firm date, yeah. And they have meetings. I was just looking through the calendar a little bit. They have meetings with Chris's team to help with agenda making and sort of a graphic for a flyer for it, and some promotional items, because that's their expertise, and we're so grateful.
So, and the week before your fair, so you don't even have to miss the fair for it.
Right, right. Yeah, well, and the board is welcome. So we would hope that you'd be able to come and join in. There will be 3 very separate and distinct speakers. One from the Attorney General's office, Scott Teeter, is coming down. He does a lot with their financial side and crimes related to scams. And then former Cass County prosecutor, actually, if the name is familiar to you. So yeah, and he's been up and he's involved in the Elder Justice Task Force at the state level as well. And then we also have the Prosecuting Attorneys Association of Michigan coming down. And then we have a dementia practitioner coming to talk about, working with and understanding some cognitive decline and how that might come out in an interview, or how you might, want to talk more softly, or, maybe phrase questions a little differently if you're suspecting that maybe somebody has dementia or Alzheimer's or Parkinson's or any number of different cognitive. And so human service agencies will be welcome, not just law enforcement and first responders, but we want our friends from Pivotal and long-term care facilities and other human service agencies to be able to join us, the Commission on Aging and all from all over. So
Probably you'll target an announcement then to the Human Services Commission.
yes,
Because
absolutely. Yep.
You said it's Cass County is the next prosecutor.
It's the one before this gentleman that just came to Branch. Yeah. Scott was yeah. Right. It's
Ooh, yes.
yeah.
Too soon.
Yeah.
Any other questions for Laura? While we have the state representative from the department here, any updates from the department for us? Have you heard anything, budget negotiation wise? I know Laura said they're hoping for an increase in those in-home services. I know what 2 budgets that were passed in the legislature said, but have you heard anything on the negotiations?
Honestly, this is the time of year I'm on the road a lot, so I've not been down as much to things.
There was a consensus revenue estimating conference, I believe, late last week.
On the 15th.
Yeah, and so if there is extra money there, everybody's gonna be scrapping for those dollars.
I listened to it. Well, and the one key interesting thing that I mentioned even at the, Wellwise board meeting is there's, some population estimate in there dealing with specifically the aging population in the state of Michigan. And by 2050, the percentage of Michigan's population that is, I think it was 55 and older, is going to be equal to that age group that's 21 to 50 to 55. So drastically aging, and 18 and younger is going to see a drastic decrease in percentage.
Earlier, no longer.
The state demographer spoke at the hearing, and this is a copy of her doing a presentation to the CSA. I can leave it if anybody's interested. It has some of the statistics, so.
And that population number is out on the, at least on the House Fiscal Agency website. I don't know about the Senate Fiscal Agency website from that. So. Okay. Thank you, Laura.
Very welcome.
Moving forward, personal health and disease prevention. Good morning, Ms. Heidi. How are you?
Good. A couple updates for you. As of May 15th, Michigan influenza-like activity levels are considered minimal, and RSV activity continues to decline. We are still seeing some cases in our Tri-County area here and there, but it is getting better. Pediatric respiratory mortality surveillance monitors deaths in children caused by respiratory viruses. And as of May 8th, there's been 3 deaths to COVID-19 for influenza and 1 RSV pediatric. Measles, as of May 14th, there's been 1,893 confirmed cases nationwide and 14 for Michigan. Hantavirus has been in the news a lot lately. So this included some information on that. There are currently 10 confirmed global cases connected to the Argentina cruise ship outbreak. 3 fatalities were reported, but there's no U.S. cases at this time, but they were monitoring 41 individuals closely. The outbreak does involve the Andes virus strain, which can be spread with both prolonged contact, and the World Health Organization has stated this outbreak is not considered a pandemic threat at this time. Salmonella outbreak, CDC is investigating 3 multi-state outbreaks in tobacco and poultry. More than 1/4 of the cases do involve children under the age of 5. There's currently 184 cases, and Michigan has 20 for the St. Paul strain. And there's been 1 death reported in Washington. Maker modernization is entering the final phase, and the go live date is still June 15th. The current Maker, which is called Legacy, will go offline on Tuesday 10th. So during that 3 to 5 days, Maker's unavailable for any kind of lookup for data entry. So staff has been informed about this, and we are prepared for that transition. And they did hold a Maker town hall recently on May 19th for local health departments and providers. They were able to just ask questions, and it was actually pretty helpful to calm some nerves, I think, but it'll be awesome. We did start the new online waiver process May 11th, and that has gone pretty smoothly. A couple hiccups, but nothing major. The immunization coordinator and other supervisors have been assisting the school and child care providers with the transition, and then Chris helped us make some educational materials along with QR code to distribute to families and providers. For WIC, the agency did receive a $15,000 mini grant from the District 9 quality collaboration, and that funding will support community Navy wearing education initiatives, and the plans to hold a train the trainer session for our breastfeeding peers along with 3 local doulas. We kind of started planning activities, and then the funding took a while to get to us, but I think we're closer to that to move forward with planning. And then Children and Special Healthcare Services staff did participate in a regional meeting with other local health departments. They always come up with a lot of good ideas from those meetings. And then I did want to just give a shout out to one of our nurse supervisors, Amy. She did complete her BSN degree, and then another one of our nurses received her master's in nursing recently. And our breastfeeding peer Savannah did get her certification as a lactation counselor. And then in the back of the room, I do have Megan Bowerman. She is a student at Western. This is her last class for her bachelor's. So she is spending around 5 days here with me and a couple other
Any questions? For Heidi and environmental, personal health and disease prevention. You can handle that one too. That's never a bad idea. Hearing none, we will move on to health education and promotion.
Good morning.
Stewie, good morning.
Our Lock It Up campaign continues. We to date have distributed 1,875 safe storage devices through our 29 community partners. Our promotions and messaging is on the radio stations. It's running through the end of May. The OHSP grant work is still very busy. We have actually set a date to do the safety event in St. Joseph County. That date will be July 11th. And the community seems to be very excited about that. The Sheriff's Department, and we're working with Burr Oak, Colon, and Centerville Departments, Fire and EMS, to put that event together. Currently, the plan is we will be doing a mock scene with a crashed vehicle and a crashed buggy, and they're planning to bring in a helicopter instead of a landing zone so that we get that experience of having a helicopter come. We are planning to provide CPR, friends and family CPR exposure, and some bleeding control, as well as anything else that we decide to come up. But one of the gentlemen from the community who's part of the safety committee met with us, with the sheriff and the fire departments. And so we've had some very good conversation about what they would like to see. We're still working with Montgomery Fire Department in Hillsdale County, as they're planning to do another safety event in July. Or I'm sorry, somewhere this summer, similar setup. So I was informed this week that our fiscal year 27 OHSP application has been moved to phase 2. So we've made it through the round 1 review, and we are waiting for finalization of our 27 award. The Hillsdale County Opioid Project, we have a meeting with the IT department in Hillsdale County the first week of June to begin discussion of development of the online resource tool. The all-staff meeting went very well, and thank you, Commissioner Leininger, for attending and assisting us with the award ceremony. Our community health worker, Lisa Redmond, has returned to work, and she has been very busy serving folks in all 3 counties. Again, we continue to see increased needs around MDHHS services applications. I anticipate that will increase as the redetermination rules are going to be changing as well. So we'll be doing a lot of help with folks to keep their Medicaid and their benefits current. We do a lot of referrals to other resources in the community, such as domestic violence, utility payments, and housing. And then we also continue to support folks as they go through their Social Security disability applications. And that is the end of my report.
Any questions for Chris?
Chair.
Mr. Stoll?
So that, the Highway Safety Grant Program, when did that begin and what does it run through?
So our initial award was for 24-25 fiscal year. So we are in our 2nd year of the grant, and so this would be the 3rd application.
Okay. And you mentioned the MDOT project to widen 86 between Centerville and 66 in St. Joe County. Is that part of that grant, or is it just part of the overall project for?
So it was a project that MDOT was planning to do a resurfacing of that MDOT had come to the table. They asked us to facilitate a meeting with the community to have conversation around that repavement of that road. And so while that project is not directly related to the grant we have, we were able to help facilitate conversation between MDOT and the community to have conversation about what they would like to see in a redesign. Now that redesign is not full buggy lanes on each side, but it is a widened berm or a widened road edge so that there's some more room for them to travel. But we continue to talk to, for example, we just met with Hillsdale County Road Commission and provided them with the data we received from the reading in Waldron areas. And so they're reviewing some of that information and we'll have some more conversation around opportunities that we can take there. So we're basically at this point, we've been gathering data, we've been providing it to road commissions, MDOT, and just trying to facilitate voice.
Yeah, okay. Yeah, I'm more curious than anything else about like if this is gonna be like a bigger plan for a bigger throughout the state or in certain areas, you know, where there's an out population.
So the gentleman who works as the traffic safety engineer, his supervisor was at our last OHSP advisory committee meeting, and he indicated that this gentleman has become very interested in ensuring that as he's planning projects in the area, he is taking into consideration the community. So, you know, small change, incremental change, and it will pay off.
Yeah. Thank you.
Any other item or questions? Hearing none, we will move forward to environmental health. Mr. Joe.
Morning.
Good morning. Good morning.
Just wanted to update the board on the tremendous job the environmental health staff's doing over in the St. Joe County office with basically every bit of your job duty being ripped up and transported everywhere. We were able to make it through food licensing season with very few hiccups. Like they have, it's over 300 facilities, I think, in St. Joseph County, and we got everybody licensed and paid within, I don't know, a week after the deadline, you know, because of mail and stuff like that. So that's a true testament to the organization and work that they were putting in over there. And yeah, the public were able to find for sure. There were a couple snafus where they came to branch, but we made it work. But kudos to them for getting that done. On the well and septic side, our corrective action plans have been submitted to the state, approved, and they're just looking for us to show that we've implemented them, and that's going to be happening very shortly. We have extended a conditional offer of employment to a individual that's going to hopefully take the clerk position here in Branch County, so I'm excited about that. We are starting interviews for our open clerk position in Hillsdale County tomorrow. Brandy Lennox, who's been our environmental health clerk for 10 plus years, a long time, has decided to retire. And I just wanted to thank her for all of her hard work when we were implementing 2 inspection programs. She really spearheaded a lot of the clerical end of it, the bookkeeping, finding all the nooks and crannies where maybe even some of the programmers didn't realize there was an issue. She found them. So really crucial in implementing that new program, and she will be missed. But we're going to be doing those interviews. I've got actually 2 days of interview scheduled for that position. Our vector techs have started. So Amelia Lutz, who is a Hillsdale College student, and Isaac Shively, who is Heidelberg, I believe, student. They're, I think this is their 3rd year as vector techs for us. They're doing a great job. They're splitting up the duties between all 3 counties and doing tick drags and mosquito checking across all 3. I do want to kind of give a shout out to Amelia. She just got back from competing at the D2 nationals, and she took third place. So that's really cool.
Yeah.
I think that's really neat. So she's back in the thick of it and getting tick drags done and stuff like that. Some notable things that I want to bring up. Annalisa Rice just completed her REHS, Registered Environmental Health Specialist credentialing. So it's kind of like an RN type thing for a nurse. For sanitarians, that's a nationally recognized accreditation that you get by taking an exam and then doing continuing education for the rest of your career. So that's a huge step for her. And it's great for our staff to say that here's another person that has taken the extra step to go above and beyond and be recognized nationally as a registered sanitarian. So that big kudos to her. And obviously Brandy is retiring, and then Laura Farkas, her last day is tomorrow here in Branch County. So we thank her for her hard work that she's done with us and wish her well on her new adventures. So that's the report I have for environmental health.
So you say you've identified a few tips.
Oh, a few.
Think about what?
I think it is, and I think I mentioned it last time. It's this time, early spring, last year, the state of Michigan had like 50 ticks submitted for identification. This time this year, there were over 300. So it's just a bumper crop for ticks. It's definitely something that we're going to be working with Chris and her team about notifying the public. We've actually ordered some tick signs that we can post where we do tick drags, because those are public areas where we go and do that. And tick dragging, just to illustrate that, it's like a corduroy fabric on a boom that's 3 feet, and we're dragging it through the brush, right? And the ticks cling to that. So then it's a bright white. The ticks pull it up, and then they're sometimes plucking them off that or themselves. Sometimes, to be completely honest. And then they take little vials of alcohol with them, and we drop them right in the vial. And we collect all those, and the state of Michigan would like everything we collect sent up. So I think we collect until that first week in June, and then the next week we'll be sending those up. So
I thought earlier this morning, mosquitoes are.
Oh, yeah.
we're gonna have a lot of those too.
They
They're
got
gonna be
blood.
What's that?
They got some blood.
Yeah, they hit home, huh? Yes, sir.
Full questions I have. So you've got on your sheet that 3 new establishments in Hillsdale County, and those, you must be honest, we're all open establishments. Must be their
Change owner. So the
And,
one,
and the one, I thought the one had never been inspected by us, because that was issued a license by
that's
MDR.
correct. Territorial Table and Tavern was always been an MDARD facility. So the way it works is if it's immediate consumption, so you can pick it up and eat it right away, that falls to local public health. If it's retail sales, so your grocery stores, your gas stations, typically that kind of stuff, that falls under MDARD's inspections. So Territorial Table and Tavern was always deemed, because of the number of, it's a convenience store with a restaurant attached, essentially. They were always saying that their retail sales were 51% more than their immediate consumption. At some point, that changed. And the state of Michigan said, well, we're no longer going to inspect you. You're going to fall into local public health. It's okay. So earlier this year, I went out there with the Hillsdale staff, because it's also a type 2 facility for water. We went out and did an inspection, went through it, got them all set up, and they're ready to go. They are now under local public health inspection.
As far as on that side, the other side still MDR.
No, we're taking all of it. So the very little that they sell in bag candy and.
Well, but MDR will still take care of the gasoline and stuff.
Oh, yes. Yes, yeah. We don't touch the weights and measures.
Okay, that leads to my next question. How long before that report shows up on our portal too?
It should be there because we did an opening. It's not there. Okay, I'll look into it for you.
As long as the owner of both facilities is the same, then it all falls to us. Now, if there was a different owner on the convenience side store, then that would be MDR still, and we would do the other. But if they, one owner,
So,
all us,
and it-
if we meet the 51% criteria.
Well, first, and I guess, and that leads to my next question, because the legal entity is not Territorial Table and Tap. So I'm not sure how we classify, do we?
that's what they put on their food license, so that's what we're going with.
Yeah, that's,
So I guess I don't understand. Legal entity,
their legal operation has a different name.
but they're
Territorial.
doing business.
That's just DBA, it's not the, I didn't know how we qualified that.
We have never monkeyed around with that, to be completely honest with you. We've got countless places that are, what did I see the other day? K&M Services doing business as Verijuice. That's a new place that's going to be trending. We license it as Verijuice.
All right.
Washington.
Well, you know what? If you went there, you got a receipt, you had a complaint, the receipt's in a different name, then it shows in the legal name, not the Territorial Table and Tavern. So if somebody took that and said, well, I need to file a complaint with the health department, how do they find them on our website when the receipt shows a different name then?
That's
And again, I'd say just,
They call us.
Yeah, they call us and I guess we'll have to dig and look at the address, go, oh, okay. We would be able to service their complaint and so.
any other questions for Joe? Thank you, sir.
Yep.
Moving forward, financial report.
Good morning. So you have before you, the bills for April. There are a number of things that are a little unusual that I'll point out today. On page 33, you have Inspiration Studio Designs in the amount of $6,750. That is the half down for the website redesign that Ford voted on. A little bit further down that page, you have LA Colonial Properties LLC. That is dealing with rent, excuse me, and first month security deposit for April for the new space, so the temporary space in Three Rivers, and then a second payment for the next 2 months rent. A little bit further down, you have Max Air Systems for $6,052. That is dealing with emergency preparedness grant where we got an additional grant to buy more equipment. So I believe those are Max Air is like a pamper, something to keep people safe. And then a little bit further down, you have Mulder's Moving and Storage. That's the bill that was for moving the furniture and stuff from the Three Rivers building into the temporary space. And then on the following page, you have our Johnson Builders for $38,500. That's the half down for the Hillsdale HVAC replacement project. I would be happy to answer any questions.
On those costs associated with the moving the furniture and the rent, why are those bills not being sent to MMRMA direct and them not paying them direct?
We are paying them and they're reimbursed.
Some of them are going directly to MMRMA. So the Van Dam and Cruising bills are going directly to MMRMA.
To me, that rent and that move should have been paid directly by them. Every month, they should pay that rent every month that we're there.
Yeah, they're reversing us, but
I know, but now we have to make budget amendment to accommodate for that as well. For additional insurance, it would have been paid directly by the insurance carrier.
Make a motion, we approve the payments as presented.
Support. We have a motion to approve the payment for the month of April as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Up next is the financial statement for the month ending of April 30th, 2026. Those are in the packet. Teresa, do you have any highlights on that? Or?
Yeah, so we are currently 2.89% under budget. There's a lot of programs that are not, they're running over, and they're addressed in the budget amendment that will come up later on the meeting. And the other thing that I would point out is on page 35 on the balance sheet, you'll see the wholesale building maintenance account has 70,000 in it, and the Three Rivers building maintenance account has 95,000 in it. Those numbers will come up later when we are talking about funding source for the roof replacement. Happy to answer any questions you have.
Do we have any questions, or do we have a motion to approve the month-end financials as presented?
So moved, Mr. Chairman.
Support. I have a motion from Commissioner Schaefer, support to approve the month-end financials. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Up next is the committee report, Finance Committee. Mr. Hoffmaster.
We met on May 18th, had a vigorous discussion on many of the things that are on the agenda that we will soon discuss, and adjourned in a very timely 9:25.
Back, you back to work.
We got back to work. Back to work.
I got back to what
Do I have a motion to approve the minutes of the May 18th Finance
Make a
Committee?
motion.
I'll support that.
We have a motion from Commissioner Howes and support to approve the May 18th Finance Committee meeting minutes. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. That brings us to the Program Policy and Appeals Committee meeting. Commissioner Stoll.
Yes, at May 20th. Much of our meeting just focused on the request from the Chirphorn issue in Central County there. Discussed it at some length and allowed a lot of opportunity to just talk about the issues that they're dealing with there. In other business, not well. Just to clarify, also heard about that issue from them. We did not reach a recommendation at the meeting because there was some new information provided. Wanted to make sure to get that out all the commissioners before we brought it to action on that. So we heard from Laura regarding the multi-year plan. Had to fill in a few details here and there still, but out there. And then we discussed procurement policy briefly, but it doesn't sound like it was quite as brief as the finance committee, but we stayed through. So
did walk by and I did see you guys.
it was.
I make a motion, we approve the minutes from the Program Policy and Appeals Committee.
Most fortunate.
We have a motion from Commissioner Hoffmaster and support to approve the Program Policy and Appeals Committee meeting minutes. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Next up, we are going to new business. The first item underneath new business is the 2027 to 2029 multi-year plan in the fiscal year 2027 annual implementation plan for the area agency on aging. 3C. Was discussed at the Program Policy and Appeals Committee meeting. Do I have a motion to approve?
I'd like to approve that.
Support.
I have a motion from Commissioner Stoll and support to approve the 2027 to 29 multi-year plan and the 27 annual implementation plan. Discussion. Or do you have any highlights that you want to indicate that were added after your public hearing and stuff?
Sure. Again, Commissioner Houts was able to attend the public hearing and provided valuable input, and that sentiments shared during the public hearing were incorporated into the planning document as well. This thing basically lives and breathes, if you will, within the state aging information system until such time that the board has approved it, and all testimony, if any is given, is incorporated. And we did receive some testimony this week officially via email from our very own Jim Cook, who is our current advisory committee chairperson and Michigan Senior Advocate Council delegate, that I'd love to share a few highlights with the board, if I may. To whom it may concern, as the chairman of the local area agency advisory committee and delegate to the Michigan Senior Advocates Council, I have a somewhat unique perspective on the plans and activities of our own AAA. In fact, as a senior myself, I'm blessed to be a part of these organizations and allowed to an insight into how these matters are discussed and eventually, hopefully, voted upon. Further, he states, keeping up with the needs of the community is essential to making sure that those needs and assistance can make connections to get it. The survey that was forwarded this year is intended to do just that. I took the survey. It was thorough and covered most of the foreseeable needs that historically have plagued our older citizens. He shares some advocacy sentiments, so I'm kind of somewhat paraphrasing the letter. It will be, the whole entire letter as submitted will be a part of the plan, but I just wanted to share highlights for time's sake. One of these areas is the availability of Meals on Wheels. There are almost always more needed than there is a capacity to fulfill it. Another issue that continues to plague the elder community is the lack of funding for helping seniors stay in their own homes instead of being relegated to long-term care facilities. Nearly 70% of those funds go to long-term cares, while only 30% is spent to assist folks in staying in their own homes. This is astonishing when it has been proven time and time again that staying in their own homes gives that person a better quality of life. And then finally, our local AAA does a remarkable job of efficiently spending its allocated funding, but as always, they can use more. I urge total support for the plan, which has been prepared for consideration. So I just wanted to share those sentiments and those highlights. Again, I physically will scan this and attach this as a supplemental document to the plan. So if you do want to see that, the final version of the plan will be on our website, and the second draft is currently on the website. So it's still a living and breathing document until such time that I click submit, which I will do probably early next week. So we've, the board education today is on the community needs assessment. And those highlights are outlined throughout the plan. And again, technically over 300 people submitted community needs surveys, and that input based on their preferences and their prioritization of the services. We listed 20 different services with brief definitions on how important they are to them now or potentially needing in the future. Home delivered meals, yet again, is number one. It's the number one way people receive support in their homes. And we definitely prioritize in-home services and access services accordingly within the budget. So the 2027 budget that's a part of the plan, what's considered the annual implementation plan, outlines how those funds are allocated and those percentage breakdowns that are evident in the budget that's in the plan reflect those priorities. So we feel very confident that those input sessions, the community needs assessment, the public meetings, the testimony received are reflective of what's been shared with us for the last couple of months. And again, we appreciate the board and all the committee members' time on the plans.
Any questions?
I did attend, and it was quite well attended by different sources of the county, and listened to their needs, and Laura did a great job.
I'm scheduled to come and see St. Joseph County June 16th. Branch County's to be determined. So we'll be sending them the full plan here in the next week. So.
And I sit on that advisory board as well, Mr. Chairman. Laura's doing a great job, and the plan is very comprehensive, thorough.
Any other discussion? Hearing none, those in favor of approving the plan presented, say aye.
Aye.
Those opposed, motion carried. Next is the website, the Board of Health resource page, and I think we've already discussed that, both in the health officer's report and in Chris a little bit as well. We did discuss that at Program Policy and Appeal Committee meeting. I don't see we need any action taken on that today.
Well, just a few of input. We are very interested and, Chris has screening. It has been, she's the expert. So you would notice today maybe that her report looks different, for example. Her report looks different because it's now an accessible document, when it gets posted to our website. So, if there is anything in the resources tab that you feel, is missing, we really need to know what that is. If there's anything on here that you feel we don't need, we'd like to know that as well. Chris, I don't know if you have anything.
Commissioner Hoffmaster.
Has that been delayed a year, Chris? Do you?
So the full accessibility rules have been delayed a year, but so it allows us the opportunity to take a good conversion look. So as we move forward with the Board of Health packets, we'll be looking to try to make sure that those will be an accessible document. Part of our conversation in the policy meeting was around creating a space for the commissioners to be able to password interact. So it would be kind of behind a wall that the commissioners on the Board of Health would be able to still get to historical documents. Since that meeting, we have done a complete backup of current systems. So everything that's currently on the website has been backed up to a separate server, so that if the public were to request something in the future, we would be able to honor that request. The main focus that we were discussing is how much do we want to have public facing and how much do we want to still have available on the site. And so that information is something that we would find beneficial to hear from the commissioners. At this time, I can tell you that we have annual reports on our current website, public facing from 2020 or 2002. Sorry, I had to train my brain. It's been a while since we've back in the single digits. So since 2002, the annual report is there. Most health departments may only put a couple of years of annual report public facing. Because again, those documents have to be able to be read by accessible software. And we also have Board of Health minutes and information from 2018 current. That doesn't necessarily need to be public facing. People could request that information from us if they want to see something previously. But again, how much of that information would you want behind a secured platform? How much of it do you want to have front facing? So those are things to consider if you would like to get with Rebecca or myself and let us know the preference, or if you would like to get with one of the PPA members and give them your preference, because I'm sure this will be a discussion at the next PPA meeting as well.
One of the things I believe we discussed at the PPA meeting was maybe a 1-year rolling history out there on that
The front facing.
front facing page. And what is that date that must be?
So they moved it out a year. So now it's April 27, 27. So it does give us time to get in compliance with everything, but this is a good time to relate it when you get ready to move from one location to another and you go through every closet and you look at your things and say, okay, do I really need to take this along? And I think that's where we're at. Do we really need to take this along, or having it on a separate server where it's historical archive is sufficient? And then what are we going to take and what can we leave in the archive?
And you always take more stuff than you should. Okay. Any other questions on that? Hearing none, that brings us up to the item C, area agents and aging fiscal year 26 provider amendment. That is on page 82.
By 91 and 92.
Yes, 91 and 92. Because there was a revision for the, I believe just yesterday.
As a result of a change in allocation from the students, yes. So last minute change.
I think a motion to approve the AAA FY 26 provider amendment.
Support. And a motion from Commissioner Stoll, support to approve the fiscal year 26 area agents and aging provider amendment. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Next up is the fiscal year 25-26 budget amendment number 2. This came from the Finance Committee. Budget amendment is in the packet. First, I guess entertain a motion to approve as presented. So moved. Support. Have a motion from Mr. Hofmaster, support to approve the 25-26 budget amendment number 2. Discussion or any highlights from that we would want to get from Teresa?
Yeah, so I will note, most of this is just moving money around and, transferring from program to program based on our 6 months of actuals. So we try to, we have to project as the whole year. We look at where we are 6 months and then make adjustments. So that's the majority of this. I will, point out that there is a reduction in the amount of the designated fund balance that we had planned to use in this budget. And those designated fund balance is that money that is set aside that can only be used in specific programs. So that is why it's not just a general fund that can be spent on anything reduction. It is a reduction in the designated fund. I would be happy to answer any questions you have.
Any questions? Hearing none. All those in favor of approving the 25-26 budget amendment number 2, say aye.
Aye.
All those opposed, motion carried. That brings us to item E, the Three Rivers and Hillsdale roof replacement funding source. 110. From the packet. And again, I don't see, well, we need action on this today, but
Yeah, so this came up because of Commissioner Leininger's questions related to replacement of the roof in Hillsdale. And would there be enough money to do that if we spent the infrastructure grant in the current year? And the answer to that, well, is kind of unknown at this point, given the fact that we don't know what replacement cost would be for the roof in Hillsdale. It is a little bit different than the roof in Three Rivers. And also, it depends on what product you want to put on the roof. We probably have enough money to, do a shingle roof. But if you want to put the standing seam on there, then there probably isn't enough money without using some infrastructure grant. It is my opinion that we should move forward with our plan to use the infrastructure grant to replace our portion of that roof in Three Rivers with the standing seam product instead of using our maintenance fund to help spend down that grant to eliminate any potential for them to pull that money back. I don't think there's a huge potential that they might pull that money back, but with what's going on in Washington, I don't trust anything. If I can spend the money now, then they can't take it back. And so that goes back to the discussion on page 35 of how much is in each one of our maintenance funds. you will notice that there is not enough money in the Hillsdale Maintenance Fund. There's only 70,000 to cover the entire cost of the roof over there with the amount of infrastructure grant that we will have left. So my proposal is that we would go ahead and pay for the Three Rivers roof out of the grant. And then, next year, when we replace the Hillsdale roof, we'll have to move some money from the Three Rivers, maintenance fund into the Hillsdale Maintenance Fund to help cover the cost of that roof. And then balance those two maintenance funds. So at the end of the day, after both roofs have been replaced, both buildings will have equal amounts in their maintenance.
Refresh my memory, you said it last month. When was that shingle roof replaced in Hillsdale?
That, I can't remember exactly. It was either in 2009 or 2008.
And when was the flat roof done? Was that done at the same
I
time?
believe that was done in 2009.
And just now talking about this, could the roof repairs that were done here that we just got the bill from Branch County, could that be contributed to by that capital improvement fund?
Yes, and I did say that that's how we were gonna pay the bill, is with that maintenance fund or that, infrastructure grant. That's where we coded it to.
Okay.
I'm doing a budget amendment for that grant this week, so.
Any questions regarding it? I'm not a fan of singles.
Sure, so that would be great.
Steel. Yeah, shingles ought to be outlawed. They don't make them like they used to. You know, you can go around and find some old T-lock shingles on houses that had good ventilation to their attic, but they're 50, 60 years old, still in good shape.
Back in the eighties when I shingled those, like carried him up the ladder.
Today as well. Yeah. Okay. Anything else there? That brings us to item F, closed session, for attorney-client privilege communication, for a written legal opinion pursuant to MPL 15-268. I will entertain a motion that if you want the proposed language that's there in the.
I move that the board enter into closed session pursuant to section 8H of the Michigan Open Meetings Act, MCL 15.268H, for the purpose of considering written legal advice and attorney-client privilege communications from legal counsel. The health officer, environmental health director, and environmental health supervisor shall be permitted to attend the closed session.
Support. I have a motion from Commissioner Hoffmaster and support to go to closed session. Any discussion?
Sure.
Yeah.
I would just make a request that be respectful of the Sherman Hormerstein. They've sat through this whole meeting and, I mean, clearly we need to hear from council, but, we should try to keep it as brief as possible.
Agreed. Concur. And I would say that if we do, we could take a short quick break before we enter that to clean the room. The room to empty out, so.
Yep.
3.5.
With that, roll call, please.
Commissioner Hoffmaster,
Yes.
Commissioner House,
Here, yes.
Commissioner Leininger,
Yeah.
Commissioner Collins,
Yes.
Commissioner Schaefer,
Yes.
Commissioner Stoll.
Yes.
Motion passes. We'll go into closed session at 10:27.
It's 3 minutes.
It's 3 minutes.
This is the, there's just,
That was making some sound. I just handed it to you so that you can recycle that too.
Are we back on the recording then? We are now back in open session at 11:10 PM or 11:10 AM. Something that video. I will entertain a motion to approve the minutes of the closed session as read prior to leaving closed session. So moved.
Support.
Have a motion from Commissioner Schaefer, support from Commissioner Stoll, and support to approve the minute. All those in favor say aye.
Aye.
All those opposed, motion carried. That brings us to item number 9, unfinished business, 54-108 Long Road failed septic system. The property owners are here. Does anybody have any questions for the property owners at this time?
No, I would just like to point out, I don't have any questions. We discussed this at length at Program Policy and Appeals. So many of the questions got answered by Kyle and Joe and the property owners and things. We spent a lot of time. I feel comfortable.
I want to thank the Schermerhorns for coming and attending our meeting.
As far as addressing the issue, I would make a motion that we decline their request for the approximately $27,000.
We have some more information, just so you know, from last week.
Chair.
We have a motion. Do we have support? Support. Support from Commissioner. We have a motion from Commissioner Stoll. Support from Commissioner Collins to decline the or deny the request for compensation.
Mr. Chair?
Yes, Mr.
Yeah, and I want to thank the two of you. I mean, you've obviously put in a lot of work into this and giving a detailed report. We have discussed it at length. And I think there's areas where we can get better as a health agency, as a board of health. But we need to make sure that we're looking internally to do that. I'm going to vote no on the motion, and really the reason why is because I put myself in your guys' shoes, and I feel like there should possibly be some kind of compromise. What that is, I have no idea, but I certainly sympathize with the two of you, and hope it works out.
Yes, Commissioner.
Thank you, Mr. Chairman. We've all given this a lot of time and energy and consideration. We appreciate Greta and Bill, you coming forward. And I think there were stumbles along the way. I want to make that
Clear.
as a single commissioner, that we could have done a better job in some areas. I had hoped coming into this Board of Health meeting this morning that we could seek some sort of a compromise situation. And so I'm going to vote no on the, because we had lengthy discussion, but it didn't achieve my goals of trying to come to some compromise situation. So I'm a no, Mr. Chair.
Are we able to say something real quick?
At this time,
That's it. Good.
Public comment.
Your discretion.
Well, because I figured I didn't say anything then because I thought we were gonna have an opportunity to at least say one word.
I will grant you up to 5 minutes at this time.
Well, I don't know if you guys know this or not, and I don't know if you got this letter that we got from Kyle saying that we are ordered to comply with this code, to consult with the health. I'm just gonna and just and not do all the letters. I'm just gonna say health department, meaning this right here. That we are ordered to comply. We are ordered, it's highlighted in black. I don't know if you guys got this letter or not, but it's highlighted, ordered to comply, to consult with the health department to conduct further soil analysis. And then at the end, and then also, first of all, the top of the letter, do you guys have a copy of this? Just so did anybody get a copy of this letter?
Well, we're familiar with the letter.
Oh, you know about this letter then?
Yeah.
Okay, well then on May 1st, he said an on-site wastewater treatment system was installed. It was not installed on May 1st. We went at length last week to talk about that. It wasn't installed. We didn't even have it, and we didn't even know he was coming until like May 5th. And it was installed on May 7th. We specifically at length talked about the letter that we got, an approval letter from the department saying on May 4th. I was like, why is it dated May 4th? We had a whole conversation on that. And now he's saying it's on May 1st. Well, there's the first discrepancy. And then he's ordering us to contact you guys or somebody, the health department, to comply. And then at the bottom, it says, failure to comply with this order may result in issuance of monetary civil penalties. You know, I feel pretty stupid sometimes because I didn't even know what that meant. What does that mean? Issuance of monetary civil penalties. So I looked it up because I wasn't sure. I had some idea, but I didn't know. Well, it's basically saying that you guys are going to fine us if we don't comply. And then it didn't say that you wouldn't get criminal charges or jail time if we don't comply to this. And what are we supposed to comply with? Contacting the health department on getting the soil samples set up? Is that what we're supposed to comply with? I don't know. Well, first of all, I emailed Kyle May 20th, 2 hours after we left this meeting last week. Do you guys have this email? I just want to make sure that we're on the same page. So you guys don't even have this email. I emailed Kyle on May 20th at 12:02, 2 hours after we left here from last week, asking him if he had a timeline on the additional bore samples that we needed to be taken for the results. We are wondering if we should hold off holding up the pump station, calling the electrician, because like I said last week, the electrician was coming at noon. If we needed to postpone the pump station electrician to hook it up, because we didn't know if the whole system had to be moved or not. And then he emailed me back this is on Wednesday, and on Friday he emailed me back and said, he said, "Good afternoon, Greta. I'm hoping we will be able to get out there next week. I will call you next week to schedule the inspection. Likewise, I will be emailing the letter of next steps and non-approval for your review. Nothing should stand out of the ordinary, as the first step of correction will be to gather the soil data." That was Friday at 4:02. 3 minutes later, at 4:05, he said, "Good afternoon, Greta. Attached is the non-approval letter for the newly installed septic system at 504 at our address. Please note that the first step towards compliance is for us, you guys, or him, or whoever, to get out there to collect the soil samples. As stated in my previous email, my hope is to contact you next week to complete this inspection. To contact you next week, which is this week, and to this day, he still hasn't contacted us. And another thing too, he doesn't need to contact us. Just go out there and get the damn samples. This has been 2 weeks, so it's been 18 days since you guys approved that letter on May 4th. It's been 15 days on the actual installation of the inspection on May 8th. So you guys have 2 weeks to go out there and get more samples. And why is he waiting until July 31st? Why is he ordered that we have to comply with this, and comply with what? Soil samples? Well, he told us twice he was going to contact us to do it. So what do we have to comply with? And then the threat of issuing a monetary civil penalties. Are you kidding? This is ridiculous. This is so absurd. We have done nothing wrong. We are the harmed consumer. We have been dealing with this shit for 18 months. Pardon my language. I'm so angry. This is so ridiculous. Now you're threatening us with penalties when we've done nothing wrong. We've been trying to comply. There's nothing to comply with. He said said he was gonna come out and do it. He never did it. He still hasn't done it. It's been 2 weeks since the installation was installed, the thing was installed. It's been 2 weeks, and not once has he ever, nobody has ever contacted us to even look at it. And then also, I would like to, I understand, this is life. This is our life. We can't even have 5 more minutes. This is ridiculous. You're just gonna limit us to 5 minutes.
But it hasn't been 5 minutes. We've got.
Oh, whatever. I mean, it's been 18 minutes.
Listen, I completely understand your frustration, and we sympathize with you. Truly, Greta, we do.
Obviously, you don't enough because we're
And we
just about
have.
the money. It's just we systems.
We have gone over this, and you are hurt. We have discussed this at length, and we appreciate the emotion that you have with it, and we put ourselves in your spot and in your shoes.
No,
And
you
Kyle,
cannot.
but listen, Kyle is going to reach out, and he's going to work with you, and we're going to try to find a solution rather than find problems. Okay. So as you guys as homeowners, it's my promise, Joe and Kyle, truly, with the best intentions, are going to reach out to you guys and make sure this is solved.
Can I ask a question? Can I just have a few more minutes just to have a conversation with you guys?
No,
I can have a conversation with you after. We'll start.
Well, and I'm not trying to be mean or anything, but we've been trying to work with you for months. We had to contact you just to get the permit. And just so you know, on the diagram that you guys say was this small diagram that you guys showed us last week. You two, no, I don't. Were you there? I don't know if you were there. But this little diagram here that you guys say was on the original permit, had the original final permit from 5 years ago, and this diagram is not on there. So because then if you look, that diagram is the final permit is on the landscape, and this is on the portrait. So somehow this diagram on page 3 got turned to the portrait side, and then something was added to it. Because you can see there's a little line of gray underneath it. So that tells me this was added after the final permit that we got 5 years ago. So I don't know if there's some shady stuff going on with that. I don't know. I don't know why it was added. Lee Zimmerman just emailed me the final permit again, and it's not on there. So this was added on afterwards, and nobody told us. So what's going on with that? And then they say it's 110 feet from the barn. This is 110 feet from the barn. It's clear out in the middle of our yard. We took a picture from both directions. 110 feet. It's not 110 feet. It's like 50 feet from the point onto the bore sample. And they're saying it's 110 feet. It's 110 feet clear out to the middle of our yard. So, you're talking about how everything is just a misunderstanding or whatever.
We just want.
It's just ridiculous.
We just want a working system as soon as possible. There's been a lot of problems with the new system already, so we just really want to get this whole thing resolved and get it behind us.
And I have a question. I don't know if there are attorneys in here, but do we have to? I mean, what are we supposed to comply with? And are we going to go to jail because we're not complying?
You are not.
Are we going to get fined?
Kyle is going to reach out to you
just
quickly, and he's going to come and do the extra soil care for us. So you will be taken.
Do we
care
have
of.
till July?
We're going to work with you, and we're going to make sure that you guys are in a safe spot to live.
Can we contact you
You can.
to be in communication with you?
Absolutely.
Okay.
Is it possible we could get a letter saying something to counteract that letter that we got?
Something better. We'll have Kyle reach out.
I want something in writing saying that we're not.
Send Kyle to you.
I want something in writing. You guys take the time to write this. Can I get a letter saying that it's not any good? We apologize or whatever.
Because that is the letter, that's the ruling at this time, and until they have those additional bore samples, there can be no additional decisions made.
Wow, this is just ridiculous. I just cannot believe this.
So
We're getting and then
you just got
another thing. We took out $30,000 out of our 401, and I need to say this. This is the only opportunity I'm going to have We took out $30,000 over the last 18 months. And that 30,000 is not in the market to earn gains or anything. So over the last 20 years, I looked back over the last 20 years of how the market did, the NASDAQ, the Dow, the S&P, and they made over 10% over the last 20 years. And now that $30,000 is not in my 401. So I did an analysis of compounded interest. We've lost with that $30,000 out trying to fight this to get what is rightfully ours that we've already paid for it 5 years ago. We've lost $150,000 potentially over the next 20 years. That's our retirement. That somebody stole from us because they did all of this. Everybody's decision on everything that they've done has affected our life and our retirement. We're potentially losing $150,000 in the market for the next 20 years. So I hope you guys can live with that.
Okay, so, that? Okay, Commissioner Schaefer.
Thank you, Mr. Chairman. I came into this meeting, hoping that we had all the information that we needed to make a good decision right here in our packet. I'm disappointed that we didn't have this piece of information to further deliberate, come to a resolve. It just furthers my, my resolve to be a no vote on this.
Can you explain yourself?
No,
What do you mean? What do you mean?
ma'am, this is time for the board for discussion.
I don't understand.
Deliberation. Any other discussion
What do you mean?
on the motion at hand?
Do a roll call.
It's up to you, Gary.
We shall do a roll call.
The motion is to decline the request for the compensation of roughly $27,000. So Commissioner Hoffmeister,
No.
Commissioner Halt, Commissioner Leininger,
Yes.
Commissioner Collins,
Yes.
Commissioner Schaefer,
No.
Commissioner Stoll,
Yes.
So now we're tied.
Motion is tied 33. The motion failed.
Thank you for the ones that did vote yes.
Appreciate it.
Can I ask why you?
Ma'am,
I
Can I make a
didn't
motion,
hear
Chair?
what he said, but I can't even ask what he said.
Can I make a motion?
yeah,
I make a motion that we advise our attorney, or that we consult with the attorney about discussing, a compromise. I know it's very vague, but essentially, I do think that we should, I'm sorry.
can I get a second?
Yes.
Second.
Have a motion from Commissioner Hoffmaster and support that we ask legal counsel to reach out to the Schermerhorn to discuss potential settlement options.
You know, it's not just about the
Hold
money.
on a second, hold on a second. Let's do this the right way, okay? We're with you, right? So you gotta, so again, if I put myself into the property owner's shoe, and I think we all can agree that, and again, what I would advise our attorney to do is put his arbiter hat on and say, okay, if I'm an arbiter, I do not think that us approving the water softener for 1,000 as opposed to 1,500 was the main root. I don't think that. I don't think it's 51%. I don't know what percentage it is, but I do think it contributed to the failure of the drain field. I would ask our attorney to try to figure out what that percentage is. And if the Schermerhorns are looking for 27 and our attorney feels it is, again, whatever that number is, 20% the cause, then the settlement should be for that, for what we feel is that cause. I think we're going to save attorney fees if we do get sued. So I think that would be a good thing. And I also think that truly, sometimes the way to get better as an organization is to go through a process like this, and the compensation hurts a little bit. And I think we get better as an organization because of it. And I think they're entitled to it, to be totally honest with you. That's my 2 cents.
Chair.
Yes, Commissioner.
Yeah.
Stoll.
So, I mean, I disagree. I mean, I don't think that that's the reason that it failed. I mean, it does, I don't think the size of the tank really has anything to do with it, honestly, so. And I think we can all 1000% agree, this is a very difficult situation for them to deal with. I mean, and I hate to see them go through it. I definitely do. It's just, I just can't support it.
Any other discussion?
We have a report saying.
Ma'am. I would, on this one, I will have to concur with Commissioner Stoll. I don't think the size of the septic tank had anything to do whatsoever with the failure of the leach bed system. And I'm concerned that any leach bed size with the amount of water that is being sent through the system with what we've seen and been told with not just the water softener, but the iron curtain, I don't think any personal leach bed system will be able to handle that on a long-term basis.
It was too close to the clay layer.
Ma'am, any further discussion? Hearing none, we will do a roll call vote on the
Can I have clarification on the motion, Mr. Chairman?
The motion is to ask legal counsel to reach out to the Schermerhorns to discuss a potential settlement option on their claim.
Commissioner Hoffmeister,
Yes.
Commissioner Halt,
Yes.
Commissioner Leininger,
No.
Commissioner Collins,
No.
Commissioner Schaefer,
Yes.
Commissioner Stoll.
No.
Motion tied 3-3, the motion fails.
You guys should be ashamed of yourself.
Is it done? Yeah, we are done on that at this time.
So,
Yep.
contact.
Sounds good. Thank you.
Thank you. That brings us back to item 10, public comment. Do we have any public comment at this time?
I would like to speak on.
Would you please state your name?
Certainly. My name is Kyle Moore, Environmental Health Supervisor for the agency. I wanted to share my gratitude for all you commissioners for your patience in the matter. On behalf of environmental health, we have been pounding our chests at the amount of time and energy we've spent on this matter. And there are things we can learn from it. I am thankful at the decision you made. It's very difficult to hear the complaints and the accusations of staff in terms of neglect, because I diligently reviewed everything we sent. There's misunderstanding and ignorance to some of the documents that were forwarded. However, policies and procedures have been in place since 2015 and even before that. And we've done, since we were made aware of the situation, everything we could to make sure that the new system they have in place is adequate and it will last. The comments of whether or not that the system is not functioning well right now, I don't know what that means. But I did just want to present that as an environmental health team, we do sympathize. Even though the claim is against us, we sympathize so much and we're willing to go above and beyond tracking time, thousands of dollars worth of time to support them. And we will continue to work with them. I still have more time to contact them. I was aware of my initial statement to them, and I diligently reviewed the correction order that was sent. The requirement for them to comply with is to have a system that is designed in accordance with the permit. That is clearly stated on the correction order. It's not just to contact us, and they have an excessive amount of time to have that done. So again, just to address some of the concerns presented, as an environmental health team, we are not neglectful of this situation, and we are doing everything we can. So that is it. I appreciate all you guys and your time.
Here, can I ask a question? Sure.
This public comment's done. Yes, you can ask a question.
Okay. Is that the letter that we sent revoking approval, is that a form letter, or did you draft that based on like?
It's a drafted letter. We have a base template that, and it legally reviewed. It always, minimum requirements have to, so we are required to base a correction order based on minimum requirements of the state. Sometimes it sounds harsh. We have to include consequences. We have to cite the code. We have to tell them what is needed, and we have to date it and address it. Those are the minimum requirements, and those are followed.
Thank you. Any other public comment?
Hey Kyle,
Yes, sir.
would it be possible to get out there as soon as possible to get the soil sample, please?
Yes, sir.
Just so that they can move on and get it taken care of, because they have to wait for that before it's taken care of.
That's correct. Yep.
Commissioner comment, any? Board member have any?
Real quick, I'll keep it brief. I know these meetings can be tough, especially on environmental health and Joe and Kyle. I'll tell you, for the record, I support you guys 100%. And I truly do think you guys are doing a great job. I really do. We've talked in the past about being a part of the solution rather than the problem. And I think we are. I think we truly are. And a part of that, when the property owners are upset, because we've talked about this, when the owners are upset because we're holding them to a higher standard for this system, it's again to protect them, right? And this is a perfect example. This is it. We want to protect them. We want to protect the homeowners. So I know it's tough, but I'm glad you guys are holding homeowners, accountable to that. And I appreciate the fact that you guys are trying to be a part of the problem. I would encourage you, just kind of like what Commissioner Collins said. Kyle, I know it was under, I know, I'm not telling you anything new. Go ahead and get with them. I know you'll do a great job doing that. Be sensitive. And I would also try to, and again, work with them as far as, permitting fees and that type of thing. I know, it's tough, but do it within reason. See if we can do that. So sometimes, taking a self-evaluation and trying to get better, just like on a team, that's what we want to do. So, but I appreciate what you all are doing as well.
On that, we may need board action to waive permit fees for Schermerhorn's for the replacement system, because I don't think the staff has that authority for our fee schedule.
I make that motion.
Support.
We have a motion and support to waive the Schermerhorn's permit fees for the replacement system at their property. Any discussion?
Does that include any other fees involved?
That would only be that.
That would be the only fee, okay.
It would be
Okay.
230. Well, it'd be 210. We do have a fee for refunds to process applications, unless.
Is that for boring fees?
Yes. That's what I'm saying.
Yeah.
Boring fees, I didn't want.
No, there weren't gonna be any.
Good.
And
We were not.
And I make that motion and I completely understand what Kyle's saying too. I know that the health agency has spent a lot in going through this process, and I don't mean to diminish that. I think you guys are doing a great job, and I know there's been a lot of labor and a lot of hours and time in that. It truly is just trying to find a kind of a middle ground, honestly.
We have a motion to waive the Schermerhorn's fees in regards to their replacement septic system permit. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Any further commissioner comments? Hearing none, that brings us up to adjournment. We are at the end of our meeting, with nothing else scheduled. We stand adjourned at the call of the chair.